Hi, everyone. For this week's discussion post, my disease process is pneumothorax. A pneumothorax is commonly referred to as a collapsed lung. A pneumothorax is considered present when there is air or gas in the pleural cavity. Air in the pleural cavity disrupts the normal pressure in the chest, which inhibits full lung expansion, so the lung collapses. Decreased expansion leads to dysatelectasis and decreased lung volume. There's quite a few different kinds of pneumothorax. There's a spontaneous pneumothorax, which is exactly that, it's spontaneous. It's typically idiopathic, and it's seen in young men, usually tall and frail. Oftentimes, these young men have abnormalities called a bleb, which is a little marking on the outside of their lung, which ruptures and causes air to insert. There's also a closed pneumothorax, which is secondary to a disease process. There's no opening in the exterior chest wall, but air enters the pleural space internally, so through the air cavity. There's secondary pneumothorax, which is associated with a disease process, typically COPD, emphysema, cancer. So a tumor, for example, would rub up against the inside of the pleura and create a hole, so air would enter that way. And then lastly, this is most commonly seen is an open pneumothorax, which is caused by trauma. The thorax has been pierced and allows air to enter the pleural cavity externally. This could also be a complication from a surgery. Some risk factors, like I said, the spontaneous pneumothorax is more common in tall, thin men. Other risk factors include lung disease such as COPD, emphysema, cystic fibrosis. Genetics plays a factor. Smoking history increases your risk. Lung malignancy, and infections such as pneumonia, and trauma. Major signs and symptoms. Pleuritic chest pain is a very common telltale sign, as well as tracheal deviation if it's a tension pneumothorax, or crepitus of the chest, so little feelings of air popping. There'll be diminished lung sounds to the affected side. And then just generalized symptoms of respiratory distress. So dyspnea, tachypnea, hypoxia, and accessory muscle use. For diagnostic testing, you can use a chest x-ray, a chest CAT scan, or an ultrasound. Typically, you see people use a chest x-ray. So you can see in this photo here, this is the whole left lung, which is fully expanded. You can see the alveoli. And then on the right-hand side here, this is the lung all shriveled up down the bottom, and this is just free air in the chest. So this is a pretty significant pneumothorax. And then new research has showed that the ultrasound is actually the fastest and most effective way to demonstrate a pneumothorax. So on the left here, this is called the sandy beach sign. You have ultrasound waves that are going down into the lung wall. And then this is the sandy beach. So the ultrasound waves are bouncing off and creating these waves here. And then on the right-hand side here, you have a pneumothorax. It's called a barcode sign. It's just the waves. There's no sandy beach anymore. And that is because the ultrasound waves cannot transmit through air. So there's nothing for them to bounce back off of as there was over here. This is just free air. And also a chest CT would show a similar picture to this x-ray over here with the collapsed lung. Treatment for pneumothorax includes you can either do a needle decompression if it's a tension pneumothorax for quick release of the air. Also there's pigtail chest tubes, which is a small chest tube. And then in a trauma circumstance, you would just do an open chest tube, which is just a large bore chest tube. I hope this was helpful. Here are the references for the images and the rest of my references. Thanks.